Are you with me? Yes. 247. 247? Good. All right. So again, homework for you was here, brainstem, reticular formation, cerebellum. But today we're going to talk about cranial nerves. Begin by this, my friends. What's the difference between a cranial nerve and a spinal nerve? Remember, these are the two pieces of the peripheral nervous system, right? Central nervous system had what two things? The central, brain and spinal cord. Peripheral means to the side, right? So the two pieces of peripheral are cranial nerves and spinal nerves. Okay? So what's the difference between a cranial nerve and a spinal nerve? Spinal nerve comes from the spine or the spinal cord. Cranial comes from the cranium or the brain, straight from it. Okay? So instead of going through this process of from the brain down the spinal cord out these spinal nerves, these nerves are coming directly out of the brain, going to where they need to go. And you have 12 of them, 12 pairs, because one goes to each side, left and right. And your job, if you remember, looking back here, you need to know all 12 names, and you need to know the functions of these 7 that I've listed here. Okay? So let's go back to our picture. And they use Roman numerals to number these guys. But those of you who just watched the Super Bowl, you should be very familiar with those Roman numerals, right? Yes. So number 1 is the olfactory nerve. What does olfactory do? It's not hearing. It's smelling. You got it. The olfactory nerve. So this is a little bulb, little end piece that sticks out of the brain. Get my brain model in my skull here. Okay. And you can see that it's, oh my goodness, my brain just fell apart. Wow, that was dangerous. It's this little white piece here on the brain model that I'm showing you. Okay? It is, right. This is frontal lobe. This is occipital lobe. Okay? So it's in the very front, which makes sense, right? Because your nose comes into the front of your face, for most of us at least. Where does that go then? Do you remember on the inside of your skull that we had this little area right here that had all these little holes in it? Do you remember what we called that? No, that's this guy right here. Cristagalli is the little piece that sticks up. And the cribriform plate. Friends, the bulb, this olfactory bulb, this nerve lays right on top of that cribriform plate. And then little, almost like roots, go down into the nasal passages, the sinuses that you, when you breathe in, all that air goes into. It stimulates those nerves. The nerves come up into that olfactory bulb, right into the brain. Different smells are made up of different chemicals. And so different parts of that receptors are sensitive to different chemicals. And when that particular combination stimulates it, it sends that signal. Yes, ma'am?
When you get hit in the nose, you know how your nose tingles and stuff?
Okay.
So, and when you start getting teary eyes,
Yeah.
it's just because like, all those nerves are right there, and it's like hitting the sense.
That kind of makes sense to me. Yes. I would be okay with that. You can damage, you get hit in the nose just right, you can damage that sense of smell because you are and somehow affecting the conduction of that nerve. Yeah. It's beautiful. Did you know that the sense of smell is highly associated with memory? Yeah. Like if you smell a certain something, Very frequently it triggers a memory of when you smelled that for the first time, or some significant event with that.
I learned that from Ratatouille.
Ratatouille. It's a highly educational movie. Ratatouille. Absolutely. It's a good movie. It's a very good movie. I agree. Okay, so that's olfactory, and that is one of the lucky 7 that you need to know the name. So it is, or the function. It is sensory for smell. Okay, that is our olfactory nerve. Moving back, number 2. By the way, where is this at in your textbook? Maybe the next page over? What page is that on? 248. Excuse me. So this is the whole, if you want everything, all the details of these cranial nerves, here it is. Okay? What I'm telling you need to know as far as functions are just what I have listed on your sheet. Okay? Because it gives you all the details about these pieces. Okay? So number 1 was what? Olfactory. Number 2 is optic. So what might you think the optic nerve does? Eyes, right? Optical, right? Something with your eyes. So if we look at the function of what the optic nerve does, it is sensory for vision. When we say sensory for vision, what do we mean by that? Okay. Sure, so it's the input as far as vision goes, right? In order for me to see and understand and interpret the visual I'm getting of you in this room, this is the nerve I'm using, the optic nerve, right? Where do you think those go? This optic nerve. Sure, yeah, straight into the eyes, right? Kind of down through these little openings that are right here. I don't know how well you all can see this, but because you can see that there's holes in the back of your eyes, right? If I look at the skull, you can look in his eyes. Well, he has no eyes, but look in the holes where his eyes would be, and you can see that it passes all the way through. And that's where that optic nerve goes through. Okay? So again, it's not just vision. What is it for vision? Sensory. Okay? You have to make sure you make that distinction, because number 3 is oculomotor. What do you think oculomotor's function is? Sorry? Motor for what? Your eyes. So the nerve that controls my eye movements, up, down, left, right, in circles, crossing, these are controlled. There's tons of little muscles all around your eye that do this. Not the, what's the big muscle that goes around the eye? Bicularis, not oris. Oculi. It's not those muscles. There's other muscles, we'll learn about these, that control the movements of your eyes. These are controlled by the ocular motor nerve. Question, ma'am?
People see their eyes inward, left like that. How would that happen?
What's that now? Sorry?
Cross your eyes.
Okay.
Stuff like that. To do that.
You should not do it?
Yeah, because this is wicked stuff. Did like actually happen or no?
I am not sure that crossing your eyes you can get stuck that way. Yeah, I'm unsure of that. I do know that it's certainly messing with your brain, because your eyes are meant to work together. And to do it like that, I mean, yeah, I can see the tip of my nose. Pretty nice. But it doesn't like it very much. Okay. So number 1 is what? Cranial nerve number 1 is? Olfactory. And its function is?
Smell.
Sensory for smell. Though there's not much motor for smell. Your nose doesn't move much. Okay? That was an anatomy joke, but none of you laughed. I appreciate that. Thank you, Clarissa. I appreciate that. I said olfactory is sensory for smell, not motor. But your nose doesn't move much, so there's no motor for smell, right? Number 2 is optic. What does optic do? Sensory for vision, sensory for eyesight, right? Number 3 is oculomotor. No R there. Oculomotor. So motor for the the eyes, right? Good. Number 4 is the trochlea. Little piece right here, a little squiggly line there. Not a very big nerve. Trochlea, if I'm not mistaken, is not one you have to know function of, but let's at least take a peek and see what its function is. The function of the trochlear nerve, it's mostly a motor nerve. It helps to move the eyes. It has some sensory fibers that also transmit about the condition of the muscles of the eye. So like kind of awareness of the eye, where you're looking, how you're looking, all that kind of stuff. Okay? But oculomotor is certainly the primary motor that raises the eyelids, moves the eyes, adjusts the amount of light entering the eyes, and focuses the lenses, which we'll talk. The next chapter we deal with is senses. So we'll talk a whole bunch about how the eye works. Okay? So number 1 is olfactory. Number 2 is optic. Number 3 is oculomotor. Number 4 is trochlear. Good. Number 5 is the trigeminal. Just by the name. Something 3, right? Trigeminal, 3. Because the trigeminal nerve has 3 different pieces. The ophthalmic division, the maxillary division, the mandibular division. Those words should be familiar to you, aren't they? Mandible, right? What's maxillary? Maxilla, upper jaw, right? Ophthalmic, again, deals with eyes. Okay? This is not one you have to know the function of, but the functions are there. Ophthalmic deals with surface of the eyes, tear glands, scalp, forehead, upper eyelids. This is the sensory for that piece. Maxillary division is a sensory for your upper jaw, the teeth, the lips, the palate, the skin of your face. And mandibular is the sensory for the lower jaw, as well as motor for the rest of your jaw. Again, that opening, closing of your jaw. Masseter, remember that muscle? Yes. Okay. So number 1 is olfactory. Number 2 is optic. Number 3 is oculomotor. Number 4 is trochlear. Number 5 is trigeminal. Number 6, and again, these 3 you don't have to know, is abducens. The abducens. That's a primary. I'll go back and show you the picture. Here's our abducens nerve, right out here. Here's our lovely trigeminal with that nice 3 branches coming off of it. So abducens. What does abducens do? That is not one you have to know, just so you see. Facial is the next one we'll know. What does it do? It's got both motor and sensory, but mostly motor. So it moves the muscle of the eyes, the muscles that move the eyes, excuse me, that's the motor there. And it's also some sensory having to do with that. So can you see that a number of these nerves do kind of the same function, right? They are similar, which is not a bad thing. If one part of this gets damaged, some of this other nerve can help take over some of that, since it's fairly important that we can move our eyes and chew our food and all that good jazz. Okay? Number 7. So number 1 was olfactory, number 2 is optic, number 3 is oculomotor, number 4 is trochlear, number 5 is trigeminal, number 6 is abducens, and number 7 is facial. Yes, ma'am?
So what will make you have bad vision?
Oh boy. So yes, what makes you have bad vision? There's like 1,000 things, to be honest. That's why there's doctors who that's their specialty is your vision, right? It can be anything from the muscles not working right. The reason why I have perfect vision. I actually have better than perfect vision. But one of my muscles doesn't work quite right. So when I have to read, instead of my eye focusing on that reading, the muscles of my eye turn. So I get headaches if I do that because that muscle is working more than it's supposed to. So
How do you have perfect vision for like the screen and stuff? Doesn't that damage your vision?
it does after a while. I guess I haven't. It's been a year since I looked at it, but even the last time I still had good vision. I can see real well. But I just get tired. And plus I look so much smarter with my glasses on, right? You know. That's why you get away. It's truthful. It's a scientific fact. You look smarter with glasses. Just saying.
Wearing my glasses.
I need all the help I can get, right? Absolutely.
But also, looking at like the screens of the computers and TVs, how does that affect your eyes?
The question, how do screens and looking at your phones and that kind of stuff, you blink significantly less looking at a screen, watching television. Your eyes have a very set pattern that they move in. And so it can overwork certain things and underwork other things. And so it gets the eyes into bad habits, which leads to poor vision.
So if you blink a lot and try to look around, and it's not that the screen actually damages it, it's just that your eyes move.
I think that's correct. I don't know of any preventative eye motion program to prevent this from happening. Mostly they'll just say decrease your screen time. But yeah, certainly just stopping and looking away is a very good thing. Facial. What do you need to know about facial nerve? It says it is sensory for the tongue. So the tongue, right? So you can taste all those tasty things you just had for lunch.
So that one facial nerve controls each of the sense types in your tongue.
Right, the different parts of taste. Absolutely, yes.
As well as the rest of the face.
And then it does motor for your face. Stay with me, ladies. Okay, so it has, according to, again, using the technical definitions here, sensory fibers that transmit impulses associated with taste of the anterior tongue, and its motor fibers transmit impulses to the muscles of facial expression, tear glands, salivary glands. Okay? So facial is a very important nerve. Has anybody heard of Bell's palsy before? That's not cerebral palsy. Bell's palsy is a different kind of palsy. Your face, one half of your face will just stop working. It'll kind of sag like this. And you can be drooling out of one side. It's a nerve condition that affects this nerve in particular, this facial nerve, that you can't control the movements in your face. Yeah, it's tough. There are things, there are PT, that's one of the things we worked on as physical therapists. There are stimulations, there are exercises, things you can do to help. It's usually a temporary thing, comes back in a year or so, but not very much fun for that time.
Wait, so if the thing with the screens is only because you're moving your eyes around differently, then how come sitting closer to the TV is a problem?
Sitting close to the TV, my understanding of that would be that your eyes have a very optimal range that they work in, and too close or too far causes stress to them. So depending on how big your TV is, there's truthfully formulas. If you have this big a TV, you should sit your couch this far away from it, both for the picture as well as for your eyes. You get too close to that, then it's. Have you ever sat in the very front row at the movie theater? It's you don't know where to look, right? It's a problem.
What about, because we used to watch movies in my basement, when you watch movies out there, you want to turn the lights off so you get a better experience.
Sure.
Is that a bad thing?
I don't think so. Not that I'm aware of. I think it makes it clearer, but I don't know. Good questions. You guys have good questions today. Okay, so number 1, olfactory. What's number 2? Optic. 3? I'm truly I'm kind of quizzing you as we're going along. One of your questions on the test is going to be, here are these nerves, put them in the right order. Or here is the numbers, give me the words. Are you with me? 4th is trochlear. Yep. 5th is trigeminal. 6th is abducens. 7 is facial. Number 8 is, ouch, just poked myself. Vestibulocochlear.
That's a big word.
Vestibulocochlear. This is one that you need to know. Number 8. It is sensory for hearing and for balance. So, vestibulocochlear. Nah, you can do it. Back when I was learning these, back in the Stone Ages, they called this the auditory nerve.
Can we call it that?
But why did they change it? Because this thing not only does auditory, so it's not only associated with hearing, it's also associated with balance. The vestibular system.
So is that why when you go on a roller coaster and you're at the park all day, and you go and you lay in your bed and you feel like you're
Yeah, absolutely. Sure. Yes. So this nerve controls, because both of those things function in your ear. I'm not sure if you all knew this. I'm sure you did. But You hear as well as your dynamic sense of balance is in your ear. We'll talk much more about this as
So
well.
like on a boat, after you get off a boat, you
Step on the ground. It feels like you're still like.
Yep, that's all your ear. It's all your ears.
Andrew came up with the stress thing, or like when you're stretching your like quad, I think.
Okay.
And you know how you normally like put something there? If you just hold your ear,
You balance
you'll
yourself.
be balanced.
Or if you put in your belly button.
Yeah, if you touch your belly button.
Yeah.
I think you guys perhaps might be alien species. I've never heard of that before. It's good. Number 9. Number 9, glossopharyngeal is this nerve. What is your gloss? Do you know what glossal area is?
My lips.
Close. Close to lips. Tongue. Tongue area. Tongue. Your pharynx is behind in your throat as well. So glossopharyngeal is dealing with sensory for the pharynx, tonsils, posterior tongue, carotid arteries, and then motor for the pharynx for swallowing. Again, not a function you have to know. Remember, your sheet is all you need to know. And
Facial and that one, they both control the tongue.
yeah, absolutely. Okay, but I call facial is the one I want you to know more. That's the anterior tongue where most of your tasting occurs. Picture. Sorry, I've been neglecting our picture here. So here's abducens, facial nerve, glossopharyngeal. We cool? 3 more. Oops. 3 more. Number 10. Number 10 is one of the most interesting nerves in your whole body, truthfully. Your vagus nerve. Take a look at what this is. It's a mixed, it's not just sensory, it's both sensory and motor. But check out where the vagus goes. It is sensory fibers that transmit impulses to muscles associated with speech and swallowing. You with me? Autonomic motor fibers transmit impulses to the heart, smooth muscles, and the glands in the thorax and the abdomen. Wait a minute, a nerve from your brain goes all the way down here? It does, without going to the spine. It also does impulses from the pharynx, larynx, esophagus, and the viscera, your thorax, your abdomen. Vagus. Spanish, isn't that very close? What does that mean? Isn't there something like a vega, vagal, something like that? Am I totally off?
Latin. But
It is Latin, absolutely. Okay, sorry, I'm not trying to put you on the spot. I thought there was something. To be a vagabond, have you heard this term before? What does that mean?
Oh, a back one or more?
Sorry?
Same thing.
Okay, sure. What is a vagabond?
No home and you
You wander. That's what that means, the wanderer. Right?
That's what I was thinking. But I was thinking of some body parts.
Okay. Yeah. Why do they call the vagus nerve a wanderer? Because it goes all these places, right? Shh. Again, remember, it starts out in the brain, but then hits the throat, hits the thorax, hits the abdomen, hits the heart. It goes all over the place.
Is that why your heart holds memories?
I don't know. I think there's actually some other neurons. I'm not sure if it has to do with the vagus nerve, but it could. That's a good question. So the definition, the function I want you to know is that it's autonomic to the heart. This is the muscle that keeps your heart beating.
This one?
The vagus nerve. Yes. It's autonomic for the heart. Autonomic meaning automatic, right? You're not thinking about it. It's not a conscious thing. Okay? Number 11 is the accessory nerve. Again, 2 pieces to that, cranial and spinal. So it does motor for the soft palate, pharynx, and larynx, and motor for some of the muscles in the neck and back. This accessory nerve. You can see now we're way down here on the spinal cord now, on the brain stem almost, where these guys are coming off. Vagus is here. And last but not least, number 12 is the hypoglossal. Again, gloss meaning what? Tongue, right? So this is the motor for the tongue. We had a couple sensory for the tongue. What was sensory for the tongue? Facial is one. What was the other one? The glossopharyngeal. You don't have to know that one, but those are the two sensory for the tongue. But motor is your hypoglossal. And that is one that I want you to know. Motor for the tongue. Okay? How do you remember these? I'm going to give you, this is the little saying, because it goes like this. O, 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 T, T, A, F, V, G, V, A, H. So, on old Olympus, Olympus's towering top, it's A already. A fin, and it used to be and. Remember, this is vestibular here. Vestibular cochlear. It used to be and, so they said a fin and German, but I changed it to say a fin von German. Viewed all hops. Again, this is an acronym that's been around for 100 years easily. Okay? If you want something, hops is like what you make beer out of, the barley. Hops. Okay? If you come up with a better one, let us know. It'd be fun to use. Okay? But this is a way that you can remember. On old Olympus's towering top, a fin von German viewed all hops. These guys are on top of an Olympus, the mountain Olympus, and they're looking out and seeing all the grains, all the hops. Yes, that's what you make beer out of. Okay? Again, I'm sure if you search, I'm sure there's plenty other of these mnemonics that are available, but this is the one that I learned. This is the standard one people will use. Okay? And again, what are they? What's O? What's number one? Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibular cochlear, glossopharyngeal, vagus, accessory, hypoglossal. So no, you need to know the whole names. Whole names. No, you need the names. Yeah, you do need the names. Okay? Any questions you have, my friends? So again, stay with me, please. For tomorrow, I want you to add, let's say for some strange reason, you thought there was going to be a snow day today and you didn't do your assignment. Would you please get the functions for these pieces, basal, nuclei through hypothalamus, and then the new ones for today, I'm asking you to do brainstem, which the three pieces, right? Pons, medulla oblongata, and midbrain. Reticular formation, cerebellum. We'll talk about those tomorrow. Don't leave yet, because we're still got about a minute or two left. Exactly what's up there on the board. 1 second.